Hello friends, welcome back on the YouTube channel Era of Nathan. So today in this video we are going to learn a very easy topic, hospital environment for child. Means which kind of environment, which kind of circumstances we have to maintain for child. So first of all, let me understand from the introduction. Means hospital environment for the child should be safe. How it means safe means provide safety to child, clean, neat and cleanliness should be there, calm means peaceful, we can say peaceful there, and the child friendly, and the whatever the environment is like a child friendly, child should be adapt the environment very easily. Help to reduce fear, anxiety, stress. Means the child means environment is like that, means a boy or the baby girl, whatever the child is there, he should be easily accept the environment and easily a nurse have to reduce the anxiety, fear, or we can say the stress of the child. Then the format promote faster recovery. So the nurse have to promote faster recovery, means we have to rehabilitate the child or the patient, and as soon as possible we have to discharge the child from the hospital, so it's kind of faster recovery. Then the second point is child friendly environment. Now the how we can create the child friendly environment. The first point is color, then picture, then cartoons, then toy and the play material. So the child friendly environment will be very easy. It's a colorful wall should be there, cartoon should be there on the wall, play material should be there, play toys should be there. Play materials like the baby boy or girl can use the play material like sleeping rigs and all horses to horse riding, small toys, and three-wheeler or bike should be there. This type of play material should be there. Then scary equipment keep out, so we have to keep out all the scary equipment and the whatever the harmful object, there should be no any harmful object for child. Means and means because of the harmful object a child can harm himself or harm other also. And the last one is separated pediatric ward, as means if it be possible, so we have to a ward of the patient or ward of the child should be separated from the hospital. Means suppose it's a hospital, so there is a particular side of that pediatric ward, and there should be a calm, clean, neat and all this type of whatever the given in the introduction. Then the hygiene and infection control. So how a nurse can maintain the hygiene and infection control in the ward for the child. So clean ward, a ward should be clean, neat and clean. Then the beds should be also neat and clean. Then equipment, all the equipment whatever the nurse is going to use, it should be clean. A nurse should be use gloves there, and the proper hand hygiene. A nurse should be do hand hygiene before procedure and after procedure in the pediatric ward. Not in pediatric or in every ward, it's a very compulsory. Then the isolation of infectious children. If the children is infectious or infected, so there should be isolation, means nursing barriers should be there. Isolation means no other child should go there. Then the BMW management. BMW, the full form of the BMW is biomedical waste management. So biomedical waste means whatever the waste is there, we have to manage it, or the nurse have to manage it properly. Then personal hygiene means nurse hygiene. Nurse have to do all the procedure, means using gloves, hand hygiene and masks, all the things. So it's done here, hygiene and infection. Next one is safety measure for the children. A nurse, which kind of safety measure should be there, how a nurse measure the safety of that child. So first one is side rail. Side rails means there is a railing or there is a barrier in the, or whatever the bed is there, a barrier kind of, child can't fall away from that bed, so a barrier should be used there. It's called side rails. Then the non-slippery floor. The floor of the ward should be non-slippery. Non-bad slip because of the sandal or anything. So it should be non-slippery. Tiles should be used in that ward. Then sharp and harmful object kept away. As I already told, sharp and whatever the harmful objects should be kept away from the child. Electric safety means all the board is there. Nothing. Electric safety means to maintaining the electric safety means board or whatever the electric things should be kept away from the child. means the height of which both are should be 5 foot. There the no child should reach there. Medicine safety means whatever the medicine, a nurse have to keep all the medicine in the locker or in the means in at the heighted level, so no children should reach there. So it was the safety measure. Now the parental involvement. So how a nurse have to involve the parent and why it's very compulsory. So first one is parents allow, a nurse have to allow the parents to be with the child. Then parents involvement, a nurse should involve the parents too. Suppose a nurse have to inject an injection, so she have to ask to parents to means communicate with the child, playing with the child, and boy is there and boy is busy in the talking with the parents, and nurse have to inject the injection. Means it's kind of play therapy or it's kind of inversional therapy. Means directly means inverted the or the consciousness of the child. Then emotions for the nurse have to provide emotional support to parents, because parents are very scary, and because of her or him child is very a child is suffering from anything, so parents feel anxiety and very scary, so nurse have to provide psychological support or emotional support. Then the health education, a nurse have to provide health education to parents about whatever the disease a baby boy is suffering from. Then the psychological support. So in the psychological support there is a topics how a nurse can maintain the psychological support for the environment of child, hospital environment. Then the first is friendly and caring behavior of nurse. A nurse behavior should be friendly and caring, means communicating very playful manner for the child, and the simple explanation of procedure. A nurse have to explain all the procedure to parents in very simple words. Suppose nurse have to take weight of child, so nurse have to explain it's very simple procedure. I will just keep a cap, means keep your boy or keep your baby on this weight machine and it's done. So simply we can explore, we can explain. Then the physical environment, means physically how the environment should be there. So first one is adequate light and the ventilation. So light of the ward should be adequate and the ventilation should be very adequate. When light means whatever the light is, it should be proper light. Not suppose any place is dark or any place is more lighter, so baby will scare of the dark places. So the lighting should be proper, and the ventilation means the air passes, means passing the air should be continuous. Then quiet and peaceful. Whatever the ward is there, it should be quiet and peaceful. Then comfortable temperature, the temperature should be comfortable. Suppose a nurse, means whatever the hospital is very costly hospital and it's providing facility to the patient, and its temperature means turn on the AC at the 60 degree, and if the boy or the patient is coming there, she is feeling cold there, so we have to maintain the temperature also. We have to maintain the ward temperature at the room temperature, we can maintain at the room temperature. So it's done. Now the next is role of nurse. So the final destination of our video is role of nurse, because we are going to be a nurse, so we have to maintain this all things. The first thing is maintain safety and cleanliness of environment. So whatever the ward is there, a nurse have to maintain cleanliness and safety. Then the avoid physical and emotional support. Provide. So nurse have to provide physical and emotional support. Physical means all the light should be there, ventilation, temperature all should be perfect, and the emotional support means a nurse have to provide emotional support and health education to parents. Then reduce fear and anxiety. A nurse have to means maintain communication level at the communicator, means therapeutic communication, and reduce fear and anxiety of the child, means like the play therapy, or we can say the means lovely, she will have to polite and lovely talking with love and careness, providing care. Educate parents, already done. Use play therapy and therapeutic communication. So nurse have to use play therapy to doing any procedure, and therapeutic communication to talking with children or even the parents also. So guys, our topic was hospital environment for child. So these are the points there. So how hospital environment for the child should be there. Hope you understand this video. If you don't understand any topic, you can comment me. And thank you for watching this video. See in next video. Jai Hind.